Thank you so much for joining us today. Really thrilled to be here. For those of you that don't know me, I'm Marc Hurlbert, the CEO of the Melanoma Research Alliance. And many of you that are joining us today do know that May is Melanoma and Skin Cancer Awareness Month. And we are really excited today to talk to some of our dear friends, Jack and Maggie Biggane, our longtime partners and collaborators, as well as Dr. Victoria Siegel, Professor of Nursing at Molloy University. And really excited today to chat about how nurses can help us in the fight against skin cancer. Before I turn it over to Dr. Siegel, wanted to welcome Jack and Maggie here today. Really honored to be partnering with you all again, and wanted to just let you introduce yourselves and Mollie's Fund to the world.
Thank you, Marc, for hosting this outreach today. We started our foundation more than 20 years ago after our daughter Mollie, who was just 20, died of melanoma. Thanks to MRA's aggressive research funding, new treatments offer hope for melanoma patients, which didn't exist when Mollie was sick. Because we know that the majority of skin cancers are for the most part preventable, it has been our mission to alert the public and educate them about a cancer that accounts for more than all the other cancers combined. Our platform is focused on awareness. We have found a sweet spot in public service announcements and have initiated skin cancer education programs for schools, firefighter communities, recreation areas, and sports teams, to name a few. But we believe this initiative with hospital nurses could be the most meaningful. Victoria, a member of our advisory board, has worked tirelessly and passionately educating nurses about skin cancer prevention. She can update you on her work and the promise of this program. Thank you.
Great. So thank you so much. Really, the work that you and Jack and everyone at Mollie's Fund on your board do is really so inspiring. And for those listeners in the audience today that don't know Mollie's Fund, do go check out their innovative PSAs. Really amazing work for schools, for firefighters, and you guys are such an amazing organization. So now thrilled to reach out to turn it over to Dr. Victoria Siegel. And Dr. Siegel, it's been wonderful working with you as we prepared the last few months for today. And you're here to tell us about how nurses can really help us in the fight against melanoma and the fight against skin cancer. But why don't you introduce yourself and give us everyone a brief background of why we're here today?
Thank you very much for having me. I've been a nurse for many years, and for about 18 years ago, I became interested in researching skin cancer prevention, as cases of melanoma have tripled in the past 30 years. So I've conducted several studies on how best to educate nurses so they can educate patients. I've been volunteering with Maggie and Jack for about 16 years, and I'm on their advisory board.
Wonderful, wonderful. Well, before we dive into some questions with Dr. Siegel, I think we'll run the video now, and so the audience can see a little bit about what we're talking about, and then we'll turn back to some questions with Dr. Siegel. And for anyone in the audience, if you do have questions on the Facebook Live, you can put them into the chat, and we'll try to answer those at the end.
Hi, my name is Dr. Victoria Siegel. I'm a professor of nursing at Molloy University. More people are diagnosed with skin cancer in the United States than all other cancers combined. 1 in 5 will develop skin cancer by the age of 70. One person dies of melanoma every 56 minutes. In the last 50 years, skin cancer has increased by 250%. With the help of hospital nurses, we believe we can change these statistics. As we know, all patients in hospital have their skin examined by a registered nurse. The nurse is looking for pressure injuries or other breaks in the skin. Why not include these easy-to-use skin cancer guidelines into your EMR? This is a natural extension as to what the nurse is already doing. Prevention of cancer has always been a priority of the nursing community. Our goal is to have this program adopted nationwide. We have been successful in 11 hospitals on Long Island so far. Here's an example.
We were able to, a 6-hospital system here on Long Island, Catholic Health, incorporate this into our electronic medical record system. It's important, it's effective, and what we are doing with skin cancer is providing the public, our patients, information to reduce the risk. I think other hospitals should take advantage of this and include it. I know that nurses say, well, we have enough to talk about with patients, enough priorities, but this is also a priority. This is a preventable cancer, and it's preventable by taking the safeguards that we can teach our patients.
Wonderful. Well, thank you for sharing that video. So, Dr. Siegel, let's jump in and want to just talk a little bit more deeply about this program. How does it work, and where are you at in rolling this program out? Very exciting to see your progress to date.
Oh, thank you so much. Well, all nurses are involved in educating patients about healthy behaviors in their daily practice. We teach about diet, exercise, medications, dangers of smoking, etc. And it's part of the role of the nurse as outlined by the American Nurses Association. I wrote an article in 2012 in which I explained that nurses examine the skin of all inpatients, and they're mainly looking for pressure injuries, but they're not teaching about sun protective behaviors nor assessing for skin cancer lesions. And this is a missed opportunity. So I developed a skin cancer prevention guideline based on CDC recommendations to be on the electronic health record, the EHR, to assist the nurse in educating patients about sun protective behaviors while examining the skin for lesions. The guidelines are evidence-based and stem from research I conducted at NYU Langone. Could you please put up the document for a minute? It's basically the skin cancer guidelines are seek shade, avoid sun, and use sunscreen, avoid tanning salons, those CDC guidelines. Thank you very much. You could take that down. There are over 4 million nurses in this country. And if we educate the patients we encounter, we could really have a positive impact on decreasing morbidity and mortality of skin cancers.
Absolutely. And it seems like it's relatively straightforward. So not only have you implemented this in your own hospital, but as we saw in the video, several other healthcare systems, from some of the places that you created this platform and this tool, and now some of the other hospitals that have rolled it out. Can you talk about sort of their experience? And we all know how busy nurses are in their day-to-day clinical practice, but how does this roll out, and does it affect nurse workload? I'm sure the audience will have questions.
Okay, great, thank you. The nurses have seamlessly incorporated skin cancer education into their practice while conducting patient assessments. To my knowledge, nurses have not found this to be a burden. The document is a few short sentences educating the patient while examining the skin. It's analogous to counseling patients to stop smoking while listening to their lungs. Of course, the timing of this education and assessment is up to the professional nurse's judgment. For example, the nurse wouldn't try to educate a person in extreme pain.
That makes sense. They can use their clinical expertise and do it at the right moment at the right time. So.
Yes, Dr. Hurlbert, yes.
Wonderful. Are there other hospitals, hospital systems beyond Stony Brook and the Catholic Health System? Where all is this being rolled out to so far?
Well, thank you for asking. And Maggie and Jack and I have worked tirelessly to try to get this implemented in hospitals. So the addition of skin cancer guidelines to the electronic health record, abbreviated EHR, have been adopted and legally vetted by 9 hospital systems on Long Island. By adopting these guidelines, approximately 250,000 patients have been screened and educated annually. Dr. Nikki Fury-Lopez, who was on that short video, is the CNO of St. Charles Hospital, and she assisted me in convening a meeting with all the Catholic Health System CNOs pre-COVID, an actual physical face-to-face meeting. And since then we have, so all the CHS hospitals adopted it, as well as Stony Brook and several other institutions on Long Island. It's 9 so far. We have since interviewed Nikki and her nurses at St. Charles, and they told us that the document was easily incorporated into the nursing assessment while assessing the skin. And as I said earlier, it's similar to a nurse listening to a patient's lungs and counseling them to not smoke. So it doesn't really add additional time to their workload.
That's wonderful. Now, as you and I have talked about this with others as we've gone on the road a little bit, and thrilled to be doing this today nationally, and hopefully lots of attention to this important effort. Wanted to just ask some feasibility questions. And I know that you're a doctor of nursing. I'm a scientist and a pharmacologist. We're neither one of us are computer programmers, but how does a hospital implement this on the back end? Does it have costs? And who at a hospital, if they're listening today, who needs to be involved to really move this forward?
Okay, excellent questions. And I'm definitely not techie. You can ask my family. The manner in which this is done is largely dependent on the electronic health system and the organization. So far, it's been implemented in Epic and Cerner systems. And it is estimated that the mechanics probably take an hour or so, depending on what's involved with that particular system. But the design and the configuration of the document have already been written, so it makes it much easier. And I have been informed that the addition of the guidelines to the EHR has not cost anything additional, as the ability to make minor changes to the system is part of the contract with most vendors. So the people in charge would be the chief nursing officer, and the chief informatics officer would coordinate this supplement.
That's wonderful. That's wonderful. Well, as I said, I think this is really an exciting effort. Really impressive to see what you've been able to accomplish, across New York, and really hoping we can make this available across the country. And I know many or most hospital systems around the U.S. do use Cerner and Epic, so this is something they could easily implement. And we hope that viewers today will reach out to learn more. And how can the audience listening today reach out to you, Dr. Siegel, or to Mollie's Fund, or to MRA? How can someone learn more?
I'd be happy to answer any questions about the guidelines. I can meet with interested parties and assist in any way I can. I'd be thrilled to help, as we have worked years on this project. So my email is on that video, and I think it's probably going to be placed on the Zoom page, and we'd be happy to do anything we can to help.
Absolutely, absolutely. And you have Melanoma Research Alliance's commitment as well to help you, and we'll sure that anyone that reaches out to us after this Facebook Live today wants to learn more through our channels. If they reach out, Renee and I will put them in touch with you and Mollie's Fund team. So, well, it's really exciting. Again, I wanted to remind anyone on the Facebook Live, you can type in your questions right into the Facebook channel, and we will receive those. While we wait to see if any questions come in, Dr. Siegel, any other thoughts or questions you'd like to leave with the audience today? And then if not, we'll bring back Jack and Maggie.
I just wanted to say that the research article should be posted on the Facebook live stream too. So if anyone wants to read that article as a reference point, it would be there.
Absolutely. It's important. I think that this is, I think it's really important that this is, has been vetted, it's been in peer-reviewed journals, and that you rolled it out now across more than 9 hospital systems. So one question came in. You said that this initiative has been similar to how nurses speak to patients about the dangers of smoking. Why do you think it's taking longer to sort of get more hospital systems to adopt this and talk about skin cancer prevention?
Excellent question. Well, first, we were trying to do it during COVID time, and hospitals obviously did not want to try anything new during COVID. But hospital systems are complex, and you basically have to get the ear of the right person to say, oh yeah, that's not so hard, we can do this, and have the buy-in. So it's kind of who you know. And Nikki Fiore Lopez was very helpful with the Catholic Health System. And then we had other people help us get into Stony Brook and et cetera. So, we're just a small team. And if others are able to assist, in spreading the word and feeling like this is important, that would be fantastic. Absolutely.
Well, of course. And you already have some great proof of concept, and now we're ready to roll it out more broadly. And anyone listening today that wants to learn more, please reach out to MRA or to Mollie's Fund, and we'll connect you to Dr. Siegel. And really happy to move this out across the country. So we'll bring back Jack and Maggie. And then while we bring Jack to the stage, one more question for you, Dr. Siegel. How could a nurse go about bringing this up to their hospital system? Who might a nursing on staff watching today, who do they talk to within their own hospital to help start to champion this?
Well, thank you for asking that. Yes, I think if they just went to the nursing administrators and said, hey, I heard about this innovative idea, and it would be simple to implement. And can we do this in our facility? And perhaps that could assist in moving it forward.
Absolutely. You know, at the Melanoma Research Alliance, we tell patients you have to be your own best advocate. And so I think answering that question, the same thing to the nurse, thank you for that great question. And you have to be the best advocate for us to help prevent more skin cancers, and go to your nursing administration and talk more about this. Well, Jack, thanks for joining us today. We'll turn the floor over to you, but really, really privileged and honored to be partnering with you all again this year, and especially moving out this innovative program.
Well, thank you, Mark. I just want to mention that the American Academy of Dermatology estimates that 9,500 people are diagnosed with skin cancer every day. And that's a frightening statistic, obviously. I believe nurses are ready to educate their patients in skin cancer. And we all know that patient education leads to better outcomes. So I'd like to say, please support this update to your medical systems. Don't hesitate to contact Victoria or myself with any questions. And finally, I want to thank Mark and the MRA team for their support and enthusiasm in presenting this outreach. Thank you.
Thank you. Thank you, Jack. Really excited to partner. Thank you, Dr. Siegel. And I hope we get a lot of coverage and press with this really short and innovative program that we presented today. And we will follow up with both of you as we get more feedback and questions.
Thank you very much.
Thank you both.